Hi, I'm Angie Hers, and I'm doing my presentation on the psychoanalysis movement. It was a movement that was invented in the clinical observations and formulations of Sigmund Freud. It put emphasis on the unconscious mental processes, and as a result, it showed that when the sources of patients' thoughts and compulsions were brought into their consciousness during the hypnotic state, the patients showed improvement. The establishment of the psychoanalytic associations and institutions gave the movement its organizational shape. Not only were there expanded psychoanalytic insights, they also had designed training programs and stimulated a certain amount of regularity and stability in psychiatry. In 1933, the founding of the psychoanalysis was inside of the American Psychiatric Association, which made the association of psychoanalysis and psychiatry become a logistic element as well. The psychoanalytic movement in the United States began in 1909. It was started when Freud gave a series of lectures at Clark's University in Worcester. In 1911, psychoanalytic associations were founded in New York and nationally. In the 20s of the 20th century, determined that psychoanalytic training was open only to physicians. It was not until 1964 that the American Psychoanalytic Association decided to open its membership to a few selected non-physicians. The arrival of psychiatrists and psychoanalysis from Western Europe in the pre-World War II years fortified the psychoanalytic movement. The basic tenets of psychoanalysis included: besides the inherited constitution of personality, a person's development is determined by events in early childhood. Human attitude, mannerism, experience, and thought is largely influenced by irrational drives. Irrational drives are unconscious. Attempts to bring these drives into awareness meet psychological resistance in the form of defense mechanisms. Conflicts between conscious and unconscious or repressed material can materialize in the form of mental or emotional disturbances. For example, neurosis, neurotic traits, anxiety, and depression. The liberation from the effects of the unconscious material is achieved through bringing this material into the conscious mind via skilled guidance or therapeutic intervention. The movement in the United States was set apart from Europe because their beliefs were quite different. In Europe, they valued the deterministic mechanic superstructure of the theory. This inferred that psychoanalysis, although psychological in nature and practice, was to be considered belonging in medicine. Thank you.